Hello, this is Dr. Dimitrios Kostopoulos, and this is another episode of the podcast Precision in Clinical Practice, Boosting Profits and Patient Outcomes with Diagnostics. And today we have put together for you a very interesting podcast that promises to provide you with gems, ideas, and tips that can take your clinical practice to the next level. I hope you enjoy it. Let's listen to it. Hi, I'm Dr. Dimitrios Kostopoulos, and thank you for taking the time to review this presentation about Hands-On Diagnostics. Hands-On Diagnostics is a subsidiary of the Hands-On Companies. Hands-On Companies is a consortium of companies that specializes in patient care, physical therapy, professional, clinical, and business education, and diagnostic testing. So the founders, I'm one of them. I'm the chairman of the board. I have 35 years of clinical experience with a master's and PhD in physical therapy. I have a doctorate in medicine and a DPT. I've been board certified in clinical electrophysiology testing for over 25 years. And I have performed thousands of tests and published numerous articles. I'm a clinical affiliate assistant professor at Charles E. Smith College of Medicine at FIU, past member of the Specialization Academy of Contact Experts for the Electrophysiology Board Exam of APBTS, and a past member of the Executive Committee of the Academy of Clinical Electrophysiology of APTA. I'm the co-founder of Hands-On Companies and the editor of the diagnostic section of the Journal of Bodywork and Movement Therapies. I'm joined by the rest of the founders and executive team of our organization, our president, Dr. Konstantin Rizopoulos, who is board certified in MSK Ultrasound with over 35 years of clinical experience, and Mr. Craig Ferreira, who is the CEO of HUDS and the CEO of Survival Strategies with tremendous experience in business consulting. And our deputy CEO is James Savas, who ensures that the HUDS organization is well-staffed and productive. Now, is there a need for diagnostic studies in the medical industry and physical therapy industry? Of course, diagnostic testing is a $750 billion industry. There is a need for accurate diagnostic results, and there is need for more access to diagnostic testing. More people have insurances now, and more people can get tested, and they want to be tested. But also reimbursement to physicians, especially in primary care, has drastically decreased. So many of these physicians are looking for other revenue resources in order to survive in their practices and enhance their practices. And I will present to you later on today how you can collaborate with physicians so that your patients can benefit from that collaboration and both of your practices can benefit financially. Now, let's establish first a clinical need. We can see that one of the clinical challenges we have, let's take, for example, here, I'm going to use this. So let's take, for example, a test for median nerve. Somebody has complaining of numbness and tingling in digits 1, 2, 3. You want to rule out carpal tunnel syndrome. So the type of testing that at this point most of you are doing is either a Tinel sign or a Fallon's test. But look at the sensitivity of the Tinel sign and the sensitivity of Fallon's test. This means that you are going to get, if you have a room of 100 people with carpal tunnel syndrome with 23% sensitivity, this means that 77% of those patients will not be diagnosed with carpal tunnel. 77% will produce for you a false negative result. Just imagine if you did a COVID test and that COVID test had only a 23% sensitivity. I don't think that anybody will do that. But also, there is a solution to that. The solution is the implementation of diagnostic testing, such as electromyography and MSK ultrasound, with much higher sensitivities as well as specificities. I'll give you this example again of cervical radiculopathy with only 30% sensitivity for the Sperling's test, which is the most common test that somebody does to evaluate cervical radiculopathy on a patient. So you see how electromyography can really give very, very valid solutions to identify a problem and also the specificity to make sure that our diagnosis is correct. All right, we conducted a multi-center research study with the participation of 465 patients. The study identified that the physical therapy patient management was changed in 62% of the patients. Why? Because of the data we received from EMG and ultrasound testing. Now, let's see here what is the current business model of physical therapy. A patient comes in, you do an initial eval, you perform a treatment plan, you get the treatment plan on that patient, you proceed with treatment interventions, you do a reevaluation or adjustment of the treatment plan, you continue PT until you end the care. But this current business model for physical therapy, besides the clinical deficiencies that we discussed it may have with the low sensitivities of the various testing you are using during your physical examination, it has a very limited universe of CPT codes that you can bill. So no matter if you do trigger point therapy or manipulation or McKenzie or whatever type of manual therapy you do, you will still bill 97140. So the universe of codes that you can bill for physical therapy is very limited. No matter what type of therapeutic exercise you're going to do on the patient, you will still bill 97110. So let's discuss now about our business model, the business model of HADS that integrates diagnostic testing at the time of the patient evaluation. So before you implement and write and implement a treatment plan, you perform for the appropriate subset of patients diagnostic testing such as EMG, nerve conduction studies, musculoskeletal ultrasound, which guides you to create a more appropriate treatment plan with greater outcomes, greater effectiveness for your patients. We find more than 90% improved patient experience and increased patient participation in the care, and more than 30% increase in the overall revenue that the practice is generating. So we addressed the clinical problem we have with physical therapy private practice. Now let's address the financial problem that exists in physical therapy private practice. Current data indicates that reimbursement rates will decrease for physical therapy until and even beyond the year 2022. Look what has happened recently with Medicare reductions, and many other insurances are following suit to Medicare. So it is a ever decreasing type of reimbursement that we get in physical therapy. And that presents a problem because at the end of the day, how much money are you as the private practice owner are taking at home? If your if your expenses and the salaries that you pay to your therapist go up and your reimbursement goes down, how do you pay for that? That cuts down in your profits. You use your profits to pay for the higher expenses with decreased revenues. So you get to work endless hours a week, you bring home less money, and the PPSA-PTA benchmark study showed that nationwide profit margins for physical therapy is 8 to 12%. And then there is no wonder why when Medicare makes an announcement, either in the past, 9% cut, 8% cut, or in the future, why everybody is so concerned with such slim profit margins for physical therapy. So, but HADS brings a solution. And what I'm showing here is real numbers for real HADS partners who are implementing diagnostics in their practices. You can see, for example, how without implementing diagnostics, a reimbursement of 85% jumps to $125, or a 47% increase, or a reimbursement even of $93 jumps to $131 per visit, or a reimbursement of $80 a visit jumps to $104 a visit, with increases anywhere between 24 to 40-something% for the practices that are participating in the HADS program. But why? How these practices can get these numbers? Okay, how do they get this significant additional revenue from their patients? Well, here is why. The national average of 1 hour of PT is $97. Of course, if there was a reduction, that would affect it. But even without a reduction, the national average of 1 hour of PT is $97. So the national average for one EMG test is $500, and national average of an MSK ultrasound or neuro ultrasound for 2 units is $200. So what do we have here? On the one hand, you spend an hour with a patient, you make $97 national average. You spend an hour with a patient doing an EMG and neuro MSK, you're making for the combo $700. Diagnostics pay 3 to 10 times more than the average physical therapy visit. And this is how these practices are able to have such significant revenues from their patients. So because of these reasons and to give solutions, we created HADS, Hands-On Diagnostics. Hands-On Diagnostics was created for 4 different purposes: to create a truly autonomous physical therapy practice by advancing the physical therapist as the provider of choice for these diagnostic tests; a purpose to you and your patients to help you, our partner colleagues, offer valuable diagnostic services to your patients and generate significant additional revenues from your diagnostic business; a purpose to the MD and other healthcare professionals community, where we furnish them and their clients with reliable, up-to-date diagnostic testing, and we help them not only get accurate diagnostic results, but we help them improve their revenues too. And I'm going to explain to you how this works. And finally, we are supporting research in diagnostic testing so that we provide the necessary evidence for the proper application and utilization of these testing technologies. So what are the tests that you learn and you apply? Electromyography, nerve conduction studies, musculoskeletal ultrasound and neuro ultrasound, evoked potential studies, and video histomography. So, and yes, these studies can be performed by a physical therapist in most states, and they get paid to the physical therapist by the insurance company. Okay, so, and there is a place for all of these type of tests in your patients. And I'm going to show you what type of patients can use what type of test in a second. But what are the benefits of the diagnostic testing? To the patient, they have a greater accuracy of their diagnosis and their evaluation. They will get better outcomes, and they'll be happier and healthier because they're going to participate more in their care. I told you that our study showed that patients who performed these diagnostic studies, they had a 90% greater participation in their care. But for you, the person who joins the HADS franchise for diagnostic testing, you are achieving greater clinical autonomy. We are offering the only fellowship program in musculoskeletal ultrasound worldwide and a board certification program through a residency program for EMG. So you will be able to differentiate your clinic from your competition. You are going to be able to bill diagnostic testing codes, not under the regular PT codes, but a totally different universe of codes with much, much higher reimbursements. And you're going to be able to add 30 and sometimes 40% more to your total revenue of your practice. And by the way, without even doing any additional marketing, you are using your existing patients to do the testing. All right. So your opportunity is to be part of a very dynamic group of professionals with the same common goals. We are right now in 26 different states at the time of this recording, and we have over 195 facilities, physical therapy facilities, that they have created these HADS-approved diagnostic centers. Our residency program is approved and accredited by ABPTRFE, the APTA's residency and fellowship accreditation program. And we are also approved and accredited on our ultrasound side by as a point of care ultrasound certification academy program. So we have all of the credentials to back up what we are providing. So let's talk about the business model now. There are 4 distinct revenue streams in the HADS business model. So let's start first with the first revenue stream. We help you establish within your practice a diagnostic component. So you start testing your patients. You provide testing to your existing patients. No additional marketing required. You bill the insurance company, and you get directly reimbursed by the insurance company for these codes that I described to you that are outside of the physical therapy universe of codes, and you are allowed to bill these codes, and you get paid 3 to 10 times more than you made from a single visit of physical therapy. Okay, so this is the first revenue stream. Now, let's discuss the second revenue stream. You're going to have a territory of exclusivity. So in this territory of exclusivity, there are many physicians, podiatrists, chiropractors, other physical therapists who are not members of HADS, and they will not be able to be members of HADS if you are a member of HADS in that territory, because you get a territory of exclusivity. So now all of these providers, when they want their patients to receive diagnostic testing, where do they send them? They send them out to some diagnostic center. So they are losing money. They are not making any revenue from this. And besides that, patients sometimes wait for weeks and weeks and weeks to get either an EMG or an ultrasound test. So instead, what we do is we offer a solution. We help you create agreements with these physicians where you and your staff go to the physician's office or the other physical therapist's office or the chiropractor's office or the podiatrist's office, and you perform testing on their patients inside their offices. So the physician now bills the insurance company. So they bill the insurance company, they collect the money from the insurance company, and they pay you a negotiated testing fee for service. So that is your second revenue stream. Your third revenue stream. Now you are in all those physicians' offices. You are performing testing in their offices. Well, where are these physicians going to refer their patients for physical therapy? That's fantastic. You are making additional revenues from getting referrals from those physicians who send their patients to you to get physical therapy services. So that is a great referral program for your practice to get physical therapy patients. And revenue stream number 4, direct access. We are helping you and we are doing for you direct access marketing for patients to come to your office, to your practice, to your HADS-approved diagnostic center for diagnostic testing and eventually for physical therapy. You bill the insurance and you get paid for these services. So I'm going to show you a quick video on how all this works. All right, here we go.
The HADS prescription to help patients and advance your practice to the future of PT. Massive numbers of people receive information about their back, shoulder, knee, or other problems via social media campaigns. They get directed to www.findbestpt.com, where they choose a HADS-approved diagnostic physical therapy center. Patients arrive and receive a proper evaluation that may include the use of diagnostics such as EMG and ultrasound imaging testing. The physical therapist creates an accurate treatment plan using both data from clinical examination and diagnostics. This plan addresses the patient's real cause of problem with 62% better accuracy. Patients get better faster and they are able to regain back their function. Then they recommend the services to their friends, family, and their doctors. And this is how we create a huge positive impact to society.
All right. Now, our commitment to you is, first of all, we're going to help you to identify the right people to train. We're going to provide you with comprehensive training through our state-of-the-art ultrasound fellowship program and EMG residency program, all programs approved by their corresponding associations. We're going to have ongoing apprenticeship and coaching, mentorship programs for you. We will guide you and help you to achieve board certification. We will support you in the business aspect, how to build the services, how to market, how to operate the business. It is a very step-by-step process that we help you through ongoing support to become a very successful franchisee, establishing your own very advanced HADS-approved diagnostic center. So how are you going to get there? How are you going to get there from the business point of view? Well, first of all, we provide you a step-by-step implementation guide. It is a roadmap. It is a guide that will help you in 10 different phases of business development to go, as I say, from zero to hero of diagnostic testing technologies. So by implementing step by step these specific steps, these specific phases, you're going to be able to achieve excellence. And of course, we are providing you with business manuals and coaching. You will have an operations manual that is going to help you set up your business operation, your diagnostic testing business operation, a marketing and PR manual, a billing and insurance manual. And all of these, they're not just passive learning manuals just for you to read. These are followed by actual courses and interactive processes that help you really master the topic and mostly apply these technologies. And in an annual basis, we will be helping you to develop together a strategic planning roadmap on the specific steps to be reaching year after year after year the next step, advancing your organization to unfathomable levels of success. All right. I'll give you an example of our unique training process. Once you sign up, you're going to you'll start with an online module, but then you will participate to a live module, whether it is EMG or ultrasound or any course. There'll be a live module, and there will be a live mentorship. It's not just like a continuing education course where you are left alone to figure things out on your own. We are holding your hand in this entire process. We are right next to you with live mentorships and virtual mentorships to help you really achieve excellence in education. And the best of all is because you are part of our program, because you have a dedicated mentor, board-certified mentor to you, you can start billing insurance companies within 2 weeks after you start in our program. So your new revenue is immediate. You don't have to wait months or years to start getting paid from insurance companies. You get paid in weeks from the moment you start working with us. As I said, we have annual symposiums and conferences in electromyography and MSK ultrasound, and we have our annual Leadership Academy with networking, mastermind groups, and strategic planning sessions. We're working together as a group to achieve higher and higher levels of excellence in our businesses. All right. So your mentors and consultants, you're going to have an EMG mentor, you're going to have a musculoskeletal ultrasound mentor, you're going to have a business mentor and a billing consultant. So through these very specific posts in the organization and people, mentors and consultants that will be working with you directly, you will become an expert in the area of diagnostic testing. We have a mentorship portal. Well, all of your reports will be uploaded to our mentorship portal. So your board certified mentor will make absolutely certain that the reports you are sending out to insurance companies, to any other healthcare providers, and to your patients, these reports are absolutely correct with no problems or mistakes. All right. So the goal then is that you will become a HADS-approved diagnostic center, and you will be the only HADS-approved diagnostics center in your territory of exclusivity. So nobody else will be able to come into HADS and open a HADS-approved diagnostic center in the territory that you control. All right, the question is many times, okay, do I have enough patients to do this? Yes, you do. If you are watching this presentation, you do, because unless you are doing exclusively pediatrics or some specific niche that does not include general PT patients, then you do have enough patients. These are the diagnoses and symptoms I have there for patients to receive an EMG, nerve conduction, evoked potential, and neuro ultrasound. I'm sure you have lots of patients who fit these type of conditions. And this is for musculoskeletal ultrasound. Any shoulder, elbow, wrist, hip, knee, ankle pathology, tendonitis, bursitis, cysts, ganglia, bone erosions, joint effusion, visualization of trigger points, functional muscle testing, muscle activation can be visualized through MSK ultrasound. And for VNG, those are your balance, your vestibular type of patients that we can also test. So I hope, before I get there, let me talk to you about the types of doctors. So what I have on the screen right now are the type of physicians and other healthcare providers that you can market your services to. And I have omitted actually nurse practitioners and physician assistants too, which are part of the equation. But any kind of these patients, internal medicine, family practice, podiatrists, orthopedists, rheumatology, oncology, endocrinology, any type of these physicians or other healthcare providers, you could market your services for them to send you patients or for you to do testing in their facilities. So the question now is, what are your next steps? If you liked what you heard, if you are even slightly excited about the possibility both on the clinical excellence as well as in the potential for tremendous revenue acceleration and profit margins, what's your next step? Well, your next step is to look at a return on investment for us to see specifically for your practice, for your patients, what is your potential and what we estimate that you are going to be able to make within the next 3 years. So we have developed a very specific step-by-step return on investment program where we will show you with lots of accuracy how much money you're going to make within the next 3 years from the moment you join the program, year 1, year 2, and year 3. So how are we going to do that? Well, what you need to do is you need to contact our director of business expansion. He or she will work with you on the ROI. How you can get in touch with them? You can call 888-447-6014, or you can go to handsondiagnostics.com and you can book a discovery call from there, and we will be able to help you, meet with you, and really help you create the future of your practice today. All right. Thank you so much for your attention, and I hope to see you all in one of our future events. Thank you. All right. That's it for today. I hope you enjoyed today's podcast and that you got some gems, ideas, and tips that you can use in your clinical practice that can create a difference in the way you practice and the way you profit. I hope to see you all next week. Until then, have a wonderful week.